Let's talk about a sound that can make any dog owner's heart drop. That sudden, hacking, and honestly, pretty scary sounding cough.
It really can be alarming, can it? One minute your dog is perfectly happy, and the next they're making this sound that has you immediately thinking, what is going on? Is he choking? And it's a very specific kind of cough. The classic description we hear is this deep, dry, honking noise, almost like a goose. It can be so strong that your dog might even gag or bring up a little white foam afterward, which is, even more worrying to see.
Well, if this sounds familiar, I want you to know you're definitely not alone. This is one of the most common things we see in veterinary clinics. So let's get into it and break down what's most likely happening. The condition is widely known as kennel cough, but in the veterinary world, we call it Canine Infectious Respiratory Disease Complex, or CIRDC for short. I know, that's a mouthful. But that word complex is really important. It tells us this isn't just one single germ. It's more of an umbrella term for an infection caused by a whole cocktail of different viruses and bacteria.
Probably the easiest way to wrap your head around kennel cough is to think of it like the common cold in people, really. They have so much in common. Both are caused by a mix of different bugs, they both spread super easily through the air, and for most healthy dogs, just like for most healthy people, it's a mild thing that their body fights off on its own in a couple of weeks. It's a great analogy that helps make it feel a lot less scary.
Now, while most dogs bounce back just fine, some are at a higher risk for a tougher time. We're talking about very young puppies and our senior dogs, because their immune systems just aren't as strong. Same goes for any dog with a compromised immune system. And it also makes sense that dogs who already have some breathing challenges, like those with tracheal collapse or short-nosed trends like pugs and French bulldogs, might struggle a bit more.
So if it's so contagious, where are dogs actually picking this up? Well, the name kennel cough gives us a massive clue. It really thrives wherever dogs get together.
Yep, the risk is highest anywhere you have a lot of dogs sharing the same space and the same air. Think boarding kennels, doggy daycare, the groomer, even a busy dog park or a group training class. The germs spread through tiny droplets in the air when a dog coughs or sneezes, through direct nose-to-nose greetings, or even from sharing things like water bowls.
So what does this look like day to day? Well, if your dog gets exposed, you're not going to see symptoms right away. There's an incubation period of anywhere from 2 to 14 days. Typically, that cough is going to be at its worst during the first week. Then, for most healthy dogs, you'll see them slowly get better over the next 1 to 3 weeks. Knowing this timeline helps you know what to expect.
In a typical straightforward case, the main thing you'll notice is that really forceful cough. You might also see some sneezing or maybe a little clear discharge from their nose or eyes. And this is so important, aside from the coughing, the dog feels pretty good. They're still bright, they have energy, they're eating well. That's a really key sign we're dealing with an uncomplicated case. And knowing that difference is everything, because it helps us answer the #1 question on every owner's mind. When should I really start to worry? When does this go from being a simple doggy cold to something more serious?
This is the difference between a mild case and what we call a complicated one. A dog with a mild case is coughing, but still active and eating. A dog with a more severe, complicated case becomes lethargic, they don't want to eat, they might develop a fever over 103 degrees Fahrenheit, or they might even have trouble breathing. These are the red flags that the infection could be turning into something like pneumonia.
And here's the bottom line. If you see any of those severe signs, that's an immediate call to your veterinarian, no question. But honestly, even for a mild case, calling your vet's office for advice is always the right first move. They can help you figure out if you need to come in. Oh, and a quick tip. Be sure to tell them on the phone that your dog is coughing so they can take steps to keep other pets in the waiting room safe.
If you do end up going in, the visit itself is usually pretty simple. First, you'll just tell the story, what you've been seeing, and if your dog has been around other dogs lately. Then your vet will do a gentle physical exam, listen to their chest, and they might gently press on their windpipe. Often, that alone will trigger that classic honking cough. And in most cases, that history and the classic cough are all that's needed to make the diagnosis.
And the good news is, the outcome is almost always great. This quote really says it all. The vast, vast majority of dogs just need some good old-fashioned supportive care from you and enough time for their bodies to do the healing work. So what does that supportive care look like? #1 is rest. Keep things calm, because getting excited can bring on a coughing fit. For walks, definitely switch to a harness to take any pressure off their throat. A really great trick is to bring your dog into the bathroom while you shower. That steam can really help soothe their airway.
And this is non-negotiable. You have to keep them isolated from other dogs for 2 to 3 weeks to stop the spread. This is a big one. It's the question every concerned owner asks. Shouldn't my dog be on some kind of medicine? It makes perfect sense to ask, but the answer isn't always a simple yes.
Okay, let's look at this. We generally avoid antibiotics in mild cases because kennel cough is often caused by viruses, and antibiotics do nothing for viruses. We save them for those more complicated cases, where we think a bacterial infection has taken hold. As for cough suppressants, they can be a lifesaver if the cough is so bad that nobody in the house is getting any sleep. But we avoid them if the cough sounds wet or productive because that coughing is actually helping clear gunk from the lungs.
Of course, an ounce of prevention is worth a pound of cure, right? There is a vaccine that helps protect against one of the main bacterial causes of kennel cough. Now, just like a human flu shot, it's not 100% foolproof, but it can make the illness much, much less severe if your dog does get exposed. It's something I strongly recommend for any dog that's social.
So if you remember just one thing from all of this, please let it be this. For most healthy dogs, kennel cough is a mild bug that goes away on its own. That doggy cold analogy is truly the best way to think about it.
Your job as their caretaker is really twofold. First, provide all that amazing supportive care, lots of rest, comfort, and love. And second, be a good observer. Keep a close eye out for any of those red flags that tell you it might be turning into something more serious.
Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.